A very good morning, Zimbabwe. This is your host, Simbi Soranga, with another episode of Current Affairs right here on the Change Radio WhatsApp channel. Today, we have another very important topic to discuss, and we are very honored to have Honorable Daniel Molokele. Daniel Molokele is not new to Change Radio. We have had him here and there on different programs. And we are very honored that he took some time today to talk to us about a very important topic, which we will introduce shortly, the healthcare or the medical services bill. Very important for every Zimbabwean to know what's going on with the bill. Welcome to the program, Honorable Malokele.
Thank you so much. Thank you so much. I'm excited to be part of your show. I'm happy that you invited me.
Well, the honor is ours. We know that you are a very busy man. I'm surprised that you haven't started talking about the point of order. So I'm sure Zimbabweans will recall that this week. I know it's exciting what is happening in Parliament, but occasionally it seems like you guys talk about some very important topics like the medical services bill. So anyhow, let me introduce Honorable Molokele. Who is Honorable Molokele? Maybe I'll let you do the talking yourself. Who is Honorable Daniel Molokele?
I can take the whole day.
Well,
the basic fact is that I'm a patriotic, passionate Zimbabwean. I love my country. I do not take it for granted that God chose Zimbabwe to be my birth country, and I'm always willing to contribute to the national development agenda. I'm a lawyer by training. I'm a graduate of the University of Zimbabwe Faculty of Law, but I've done several degrees since UZ. I have a master's in human rights law. I also have a master's in business admin. I'm currently doing a PhD in leadership studies. I've practiced, I'm in Parliament. This is my second term. Mostly my background is public health. Most of my adult life I've been in public health from a civil society point of view, having worked with international organizations after spending almost 15 years living in South Africa.
Well, that's the abbreviated version there, Honorable. Thank you so much. It's a very long resume, and that's why Zimbabweans are very fortunate to have you on this program today. So we're talking about the medical services bill. I would like for you to tell our viewers and listeners what is in the medical services bill that's being debated or that has been introduced in Parliament.
Yeah, the Medical Services Amendment Bill has been reintroduced. You'll take note that in the previous Parliament, which was the 9th Parliament, it was actually introduced and debated, and public consultations happened. It went through all the stages of Parliament until presidential assent. So the president then returned it back to Parliament. So we are starting again the process. Because a lot of people raised objections and frustrations about the previous bill. So we're starting afresh. There's a new Minister of Health and there's opportunity to start afresh. Basically, we're aligning the Medical Services Act to the Constitution. The Constitution is adopted in 2013. That is a much more robust and expanded Bill of Rights. Included in that Bill of Rights is Section 76, which guarantees the right to healthcare services for all citizens of Zimbabwe. So you will then go through the provisions or the clauses of the amendment bill, and you will see that there is a deliberate effort to broaden the opportunity to access healthcare services for vulnerable groups, marginalized groups, elderly people, and more importantly, people in cases of emergency who cannot afford private healthcare services. So it gives stipulations or guidelines for private hospitals or private medical service providers instances where they can sort of take in a patient who is not necessarily able to pay for the cost, but because it's a life-saving situation, they have to do that in order to fulfill the expectations of the Constitution, which talks about the right to health being available for all citizens. And it also gives provisions around essential services and making sure that healthcare services workers balance between being employees and also being lifesavers. So in terms of negotiating with their terms and conditions of employment without necessarily putting lives at risk. So there's a lot of issues that need to be unpacked. But the bottom line is about the guidelines on provision of medical healthcare services in the country.
Well, thank you very much, Honorable, for that breakdown of the medical services bill. So one issue that has been talked about widely by Zimbabweans is about the fact that private hospitals, public hospitals, should not refuse patients who need emergency care. So the question is this a game changer, or do you think that this is just a hollow political?
Just like in the 9th Parliament, it was a very controversial clause because private healthcare service providers do not get state subsidy. They don't get support from government. So they are not necessarily focusing on just providing healthcare. They're also focusing on making sure that they are viable and sustainable businesses. So the basic principle is profit making. And if you are administering a private healthcare center, you are not necessarily going to worry about the right to health. You are going to worry about the opportunity to make money. So it's a balancing act between allowing citizens who are not necessarily able to afford private healthcare services, but in life-saving situations or emergency situations, being able. So the debate will be, like they said, the devil is in the detail. The debate is in how long can a private healthcare service provider keep a patient who they know that they will not pay for the bill, and how much can government then be involved also in subsidizing that special patient? Because at the end of the day, that private medical healthcare service center is not supposed to provide healthcare service for free if it has to be viable and sustainable. So the details will be there for debate. They will be there for public hearings and consultation. We encourage individual citizens, we encourage business people to come out to the public hearing, to also submit position papers, so that at the end of the day, all interest groups, all stakeholders are aligned to the expectations of the law. But it's a balancing act, because it is also not going to make the Section 76 of the Constitution realistic if all the private healthcare services providers don't respond to those citizens who are not as fortunate when they really need support, when they really need life-saving support, when they are in cases of emergency. Let's say after a road accident, and then the nearest hospital is a private hospital, and then the private hospital says, put the dollar first, and then we'll deal with you later. Then that, in that context, it will make the right to health under Section 76 of the National Constitution very hollow and rhetoric. So that is the balancing act, to say that private hospitals have a duty to protect or to sustain lives, despite the fact that they are also obliged to survive as businesses.
That's really, I keep hearing you say a balancing act, because people have said that public hospitals, which are supposed to be supported by the government, right now, some of them are collapsing. And now we're asking private hospitals to provide care on the premise that the government would then kind of underwrite that expenditure, which is not paid for by the patient who can pay. So I keep hearing that. The other thing that I was going to mention is about the fee capping. So it seems like in the bill, the Minister of Health can determine how much private hospitals and public hospitals can charge for a visit. What is your take on that? Is this a good idea or no?
I think anyone who lives in Zimbabwe knows how exorbitant pricing has become, not just for medical services or healthcare services, but for any other products. it's a free-for-all show. So I think it's important that there be a provision in the law that allows for those representatives of private healthcare service providers, public healthcare service providers to continuously engage the Minister of Health so that they have realistic price systems so that the right to health is not limited to a few citizens of the country. The population of the country is 16 million Zimbabweans, and we can guarantee you that the majority of them will never be able to afford private healthcare in this country. Remembering that even medical insurance in this country, last time I checked, is less than 15%. I think other figures go as below as 10%. Out of that population of 16 million, less than 2 million Zimbabweans have got medical health insurance or medical insurance. So they can never afford private health care. So, like I said earlier on, you say every citizen has the right to health. Then at the same time, most of the specialized or quality healthcare services are in the private sector. So when there's a case of emergency, the public health sector might not be able to respond adequately. So there is need then for the private healthcare sector to get involved without compromising their main reason for existence, which is to make money and to be profitable.
Well, it's really a balancing act. There has to be some rules guiding the fees, the access. I think every Zimbabwean agrees with that. But also the healthcare providers themselves, they have to stay in business for them to be able to offer those services to everyone. So I think there is a lot of work that needs to be done, and we're going to talk about that a little bit. I wanted you to delve into the systemic diagnosis of the healthcare problems we face in Zimbabwe. From your perspective, what would you say are the biggest challenges that are crippling Zimbabwe's healthcare system?
You know, I grew up in Zimbabwe in the 1980s. When Zimbabwe became independent, I was 5 years old. So throughout the 80s, I was growing up in Zimbabwe. And one of the things I kept listening to on national television and national radio was a government-led mantra that said, health for all by the year 2000. Health for all by the year 2000. And today is 2025. I can assure you that there is no health for all in Zimbabwe. In fact, where we were as a country in terms of healthcare services, medical services in 1980, we could be better off in 1980 than in 2025. So the situation has moved from bad to worse. As we continued with our existence as an independent country, we didn't invest enough, especially in terms of expanding our public healthcare services to the extent that they got overwhelmed. The funding model was very minimal. So today, our public healthcare system has collapsed and is struggling to cope with the pressure. And we need more hospitals to be built. We need more healthcare professionals to be employed. We need remunerations or terms and conditions of employment that are better, because a lot of our health professionals have left the country. Remembering that, like my wife is a graduate of the medical school at UZ. She's a medical doctor. She left Zimbabwe in 2003 as a junior doctor, and she's been living out of the country for 22 years. And most of her classmates are not in Zimbabwe at the moment. So it's now a trend that we train the professionals, but they don't stay in Zimbabwe. They have to go and look for greener pastures. So we have to find ways to make it easier to retain skilled medical personnel. So as things stand, most of our public healthcare centers or facilities are not able to play their role of protecting and saving lives. So the situation is dire at the moment.
That's what you have just described is a dark situation for the health system in Zimbabwe. And I happen to know your wife, by the way. She was my classmate, and I'm also outside the country. And I know a lot other of my classmates who have moved out of Zimbabwe. We would want to work in Zimbabwe for sure. And we want the healthcare system to work. But obviously, it's not working. So what would a fit for purpose or hospital system in Zimbabwe look like? What would it look like? What do we need, just in broad terms?
I think in terms of public healthcare services, we're at primary healthcare level. So we need to make sure that in a town or in a city, we have enough clinics that provide primary healthcare services that are accessible to the local communities with proper staff, with basic medicines, with proper diagnostic machines. So for us to get there, we need to increase funding for health. And as things stand, we have been reducing funding for health. So it's a big challenge because at the end of the day, the everyday experience of a citizen is so different from the expectations of the medical services in the country or from the healthcare services. There is a big gap between what an ordinary citizen expects if they have a stomachache or a headache or something like that, or malaria. When they go there, most of these services that they expect to get, they are not getting them at the moment. So we need in each and every ward some kind of health center, and more importantly, in each and every district, a hospital, in each and every province, a hospital. We need to invest into proper hospitals and clinics.
That's a lot there, Honorable, and I'm sure that can be done. So the question is, if we were to repair the legislative bill that is on the table right now, in terms of how to fix the medical services bill, what changes must be made to make it effective and more citizen-centered, so that this idea you have of the healthcare system in Zimbabwe becomes true?
I think the most important thing is that citizens of the country must be encouraged to contribute towards the provision of healthcare services, especially in the public sector. I doubt that it's a good idea to say healthcare services or medical services are free, because someone has to pay. So we have to have some negotiated pricing model so that citizens contribute. And then government then also increases funding for health. Then this will then allow us to invest in the healthcare infrastructure, including the human resources, returning some of the skills, and making sure that there are medicines, there are diagnostic machines. So the most basic thing is that we must meet each other halfway. Interestingly, Zimbabwe has got a health insurance bill that is coming through, where the government also wants to make sure that as many Zimbabweans have got medical aid cover through the public health insurance system that they are going to bring through this bill. Maybe that could also help to increase funding for health.
Oh, wonderful. So you would want someone has to pay for the healthcare. So basically, in some countries, they have what they call socialized medicine. Like if you go to the United Kingdom, Sweden, Canada, they do have a healthcare delivery system where automatically you get to a hospital, the government takes care of it. But it's because every Canadian pays for that healthcare. So when you get sick, you don't have to worry about that. And I hope that is what is coming to Zimbabwe when we have this healthcare, hopefully healthcare for all. I don't know, or universal healthcare, whatever you call it. But anyhow, Honorable, is there anything else that you would like Zimbabweans to know about the medical services bill that we didn't talk about this morning?
I think the other thing that you need to talk about is the fact that in the bill, we are talking about situations where the government itself is saying for us to provide the right to health in Zimbabwe, the private sector has to come to the party. So to the extent that the private sector has ordinarily been outside the public healthcare service system, now they are introducing a new concept of private partnership, where you will see private healthcare being asked not to just consider minimal supporting, through corporate social responsibility and so on. The government is like saying, we are struggling. We need you to play your part as citizens. the private healthcare sector is going to be pushed beyond this elasticity, because now it looks like the government is saying, we need you to subsidize our public healthcare system. And this compromise, I doubt whether it's sustainable. Because in my view, we need to have the private healthcare sector complementing the public healthcare sector. But the political elite in this country don't use public healthcare services. They go to other countries. They go to South Africa, to India, to the UK, to America. If we would consider using Parrenya, Tompilo, UPH, and Goma, and others, then these political elite will then increase the budget towards these institutions. Then it would also improve the public healthcare system. So we have a situation where the vulnerable, the marginalized, the poor of this country are the ones who are using the public healthcare system, and the elite, especially the political elite, are the ones who are not using it. And that's why the private sector is being forced now to subsidize the public healthcare system. But I think Zimbabwe has got enough resources, it's got enough budget capacity to improve the quality of the public healthcare system.
That's a lot to unpack there, Honorable. And obviously, we could talk all day. I know healthcare is on your heart, on your mind. And we have really benefited having you this evening to talk about this. While you talk about the political elite, there are two politicians whom I will highlight who died in Zimbabwe. We have vice presidents. We have Joshua Ngomo. We have Simon Mzenda. But we then have our first president dying outside the country. And that is very unfortunate. Right now, Zambia, they have Edgar Lungu. He apparently died in South Africa seeking healthcare. So we hope that this changes for Zimbabweans. But before, I know you have a weekend coming ahead of time. So Zimbabweans want to know, this is the last question for you. We ask everyone who comes to this program, what you spend your time doing outside Parliament, outside the courtroom. What do you do? What do you do in your leisurely time, Honorable Molokele?
I think I have to be honest that last year in February, I went back to school. So this is now my second year at university. I'm doing a 4-year degree, a PhD. So it's taking a lot of my social time. But outside that social time, I'm a very religious person. So I'm a Christian. I have to participate in church. I also have got a heart for sports, especially soccer or football. So I'm involved, especially in Zimbabwe at the moment. There's a big project where I'm part of, where we're building the Arsenal Football Club Supporters Association. So I'm coordinating that process. We've been setting up town-based branches and town-based committees, and we'll be a national structure, and also part of the African network of Arsenal supporters all over the continent. So that's something I've been busy with. And I also like reading. I also like swimming. I like dancing. I like traveling. Those are some of the things that I do.
Well, thank you so much. I know that's a lot there, and we really appreciate your time. And I hope you say hello to your wife and the rest of the crew there in Zimbabwe. I hope you have a great weekend.
Thank you so much, and Sam too. Thank you so much for hosting me.
Anytime, we hope to have you again in the future, and all the best in your studies.
Yeah, well, thank you so much.
Thank you.